Hi, I'm Kim.
And I'm Sophie.
And we're from the University of Wisconsin-Madison Family Medicine residency program. And we'll be showing you a tomato uterine model today that we use to practice gynecologic procedures.
In order to make the model, you need a firm Roma tomato, 2 paper cups with the bottoms cut out, and a condom. This should be about 50 cents total. And in order to make the model, first we're going to put the tomato inside the condom. And you want to make sure that the cervix part of the tomato, or where the stem was, is facing up towards you. Okay. So this is a non-lubricated condom. Once you have the tomato inside the condom, you place the cup with the bottoms cut out on top of the tomato. You reach in and grab the top of the condom and pull it over the lip of the cup. We use 2 cups because it gives more stability, but now you can see that the condom provides a simulation of the vaginal canal, and the tomato is the cervix. We'll now demonstrate how to practice an intracervical and paracervical block using the model. For this, you'll need a 10 cc syringe with at least a 2-inch needle. You'll be using 1% lidocaine, which you can buffer if needed. For the intracervical block, you will inject at 12 o'clock, 3 o'clock, 6 o'clock, and 9 o'clock, as you can see marked on the model. You'll inject 4 mils at each of those locations. So I'll demonstrate the injections. So we're injecting 4 mils in each location.
Now we're going to demonstrate a paracervical block. There are 2 steps to this paracervical block. The first step is doing a tenaculum site injection at the 12 o'clock position. You will then place your tenaculum and use the tenaculum to visualize the cervico-vaginal junction at the 4 and 8 o'clock positions of the cervix. So for the tenaculum site block, I will demonstrate. It's just a superficial injection at 12 o'clock. And this will be 2 mils of 1% lidocaine. And you will be able to see blanching of the cervix. Unfortunately, the tomato doesn't show that. Placement of the tenaculum will then be on the anterior lip of the cervix, or the tomato. And this is where you would want to make sure that you have a firm tomato for practice. And now for the rest of the paracervical block, we will want to make sure that we can see or envision the junction between the cervix and the vagina. So on this model, it's really where the paper cup meets the tomato. And this will be, again, at the 4 o'clock and 8 o'clock positions. And you'll be injecting 8 mils into the 4 o'clock position, and then 10 mils into the 8 o'clock position, for a total of 20 mils.